we think the YouTube audio should be working as expected. So I think we have successfully tested all the audio part on our site.
Yeah.
Ladies and gentlemen, good morning. Our program will be beginning in 5 minutes. Please take your seats. If you need interpreter devices, you can find them at the back. Thank you very much. 各位来宾您好，讲座5分钟后即将开始，敬请尽速就座。如果您需要同步口语服务，可以会场入口处接触耳机，谢谢。 Good morning, ladies and gentlemen. Welcome to today's public forum, The Origin and Management of COVID-19, Views from the U.S. Front Line, a public forum with Matt and Yen Pottinger. I'd like to introduce today's moderator, Professor Syaru Shirley Lin, founder and chair of the Center for Asia-Pacific Resilience and Innovation. Shirley?
Good morning. Now I feel very, very tall. Good morning. Thank you all for coming here today. And thank you for all of those watching online, most of them from the United States, but also from around the world. I'm Syaru Shirley Lin, chair and founder of the Center for Asia-Pacific Resilience and Innovation, or CAPRI, which is co-located in Taipei, as well as the Miller Center for Public Affairs at the University of Virginia in Charlottesville, Virginia. Whether you're in the room with us, it's a room filled with people from all walks of life at the Mandarin Oriental Hotel. I'd like to welcome you to today's program on behalf of both CAPRI and the Miller Center. Yen Pottinger spoke at the Miller Center's 2020 Battle Symposium on whether China and the US could still cooperate, even though their political relations deteriorated. It is good to welcome them back to the Miller Center in Taipei. Today's event is the first public forum jointly hosted in Taipei by CAPRI and the Miller Center. This session is entirely in English with full simultaneous translation in Chinese on Zoom and in this room at Taipei's Mandarin Oriental Hotel. We have an impressive mix of people in today's audience, including scholars, representatives of the public and private sectors, students and leaders in nonprofit organizations, and the media within and outside Taiwan. We also have members of CAPRI's board of directors here in the front, and many supporters in attendance today. There are so many that have made this possible that it is impossible to list them all. I'd like to thank you for your commitment to our mission. As Taiwan's first nonprofit, nonpartisan, international public policy think tank, CAPRI's work is made possible by our growing network of supporters in Taiwan, throughout the Asia-Pacific, and around the globe. Today's topic is integral to what CAPRI has set out to do. In 2020, as we were preparing for the establishment of CAPRI, I gathered an international team to conduct research and develop recommendations for some of the toughest challenges facing the Asia-Pacific, including public health, the environment, and the economy. At that time, many people around the world thought we had reached a turning point in the COVID-19 pandemic. Vaccine coverage was rising in many countries, domestic restrictions were beginning to relax, and international trade and travel had started. As the Asia-Pacific hub of the Global Reform for Resilience Commission, our team set out to conduct research on policy challenges related to the post-pandemic world order, starting with a research report on resilience in the Asia-Pacific, vaccines, and the triple challenge. We found that in late 2021, the Asia-Pacific faced challenges in achieving vaccine equity, rolling out vaccines to communities, and developing agile vaccine manufacturing. To launch this report, the Miller Center had a 3-hour webinar with 14 speakers from 5 different time zones, from industry, government, and academia, to discuss vaccination and the pandemic responses across the United States, Europe, and the Asia Pacific, which you can still watch on the Miller Center website or on CAPRI's website. This year, well, last year, it's now 2023. In 2022, CAPRI became part of the Partnership for Healthcare System Sustainability and Resilience of the World Economic Forum. It is an initiative to conduct research on how healthcare systems around the world have weathered the pandemic and how they can prepare for the next crisis. One of CAPRI's key objectives is to gather scholars, policymakers, and industry and community leaders to share innovative ideas and build a collaborative platform for the Asia-Pacific region. With that aim, CAPRI and the Miller Center are excited to present today's public forum, and we have more events lined up for the next few months. Next week, founder of Tokyo's Tatsuoka Group, Omori Nobumasa, will be in Taipei to share how he is innovating long-term care in Japan. On March 22, CAPRI welcomes one of the most important U.S.-Taiwan relations expert, Richard Bush, to speak about building Taiwan's resilience for an uncertain future. On April 19th, CAPRI's U.S. launch at the University of Virginia will feature Malcolm Turnbull, former Prime Minister of Australia and chair of CAPRI's International Advisory Council, and his wife Lucy, former Lord Mayor of Sydney, in a discussion on resilient governance from local to national to global. I'm also pleased to announce that on May 29th, CAPRI will hold its first annual meeting in Taipei, where we will unveil new research and bring together the International Advisory Council, Board of Directors, guests, and supporters to support CAPRI's one-year anniversary of promoting innovative policy and better governance in the Asia-Pacific. The world has learned that COVID-19 is not so easily managed. 3 years into the pandemic, we know that the virus can rapidly evolve, become more transmissible, and evading protection of vaccines. Governments must balance between protecting public health and enabling normal economic and social life. As the world attempted this return to normalcy in 2022, my team realized the importance of ensuring that learning from the pandemic across different countries is applied to all areas of public policy, from public health to economic prosperity and environmental sustainability. That is the mission of the Center for Asia-Pacific Resilience and Innovation. We founded the foundation here in Taipei and at the Miller Center in Charlottesville to enhance global resilience and promote innovative governance by drawing on the experience of Asia-Pacific through comparative public policy research. 2023 marks a new stage of the pandemic as all countries, notably China, as of 2 days ago, have opened up. And as the world attempts to return to normal, governments may not have learned that all the lessons which should have been learned. We need evidence-based solutions and bold leadership to anticipate and prevent the next health crisis. To help us understand the origins and responses to pathogens like COVID-19, we have two incredible speakers here. Matt and Yen Pottinger's expertise is perhaps perfectly suited for today's discussion on the origin and management of COVID-19, because both of them advised the US government during the crucial first year of the pandemic. Matt's experience covering the SARS pandemic as a journalist in China informed his advice to the Trump administration when the virus first appeared in Wuhan. Having heard from friends in Taiwan and in China about the new virus, Matt recognized the virus spread as a national security concern and advocated early measures aiming to stem the spread of the virus in the United States. Yen's specialization in virology and HIV surveillance similarly set her up to advise the CDC and several ministries of health on safety protocols and diagnostics for COVID-19. Several books and publications about the pandemic have highlighted both of their roles in sounding the alarm on the COVID-19 outbreak. I highly recommend to you The Plague Year by Lawrence Wright and Silent Invasion by Deborah Birx. Neither of them has been translated into Chinese yet, but I'm sure that will soon come. I will start today's forum with a discussion with Matt and Yen on stage. Then we will kick off the Q&A with questions from two of our board members, also founding members of our research committee of CAPRI, Professors Harry Harding and Chang-Chuan Chan, before we open the floor to audience questions. Please submit your questions via our website, caprifoundation.org, where you can access. Also, you can use the QR code on your pamphlet to submit your questions. If you're joining us online, please go to the website to submit your question. Even though our speakers wear many hats and can answer almost any question you can imagine, I encourage you and ask you to please submit questions that only relate to today's topic of discussion, the origin and management of COVID-19. With that, I'd like to start by asking What about your views on China's recent COVID response? This seems to have come a full circle from early 2020 when all eyes were on China and Wuhan when the virus started to circulate. Now we see the full dismantling of COVID-19 restrictions in China. Should we be concerned? Is the world ready for them? What does 2023, the fourth year of the pandemic, look like? Maybe we start with Matt.
Okay. Shirley, thanks so much. Congratulations to you and to Harry and the whole team at CAPRI. I've gotten to know your team over the last couple of weeks that we've been here in Taiwan. I've just been very impressed with them personally, but also with the mission, which you're filling a pretty big niche that has yet to be filled. You're a privately funded think tank in Taiwan, really with an entire regional look at what needs to be done to maintain resilience. So big congrats to you and on the launch and for your mission. Look, on China's response to COVID over these past 3 years, I think it's important first to differentiate between Chinese people and the Chinese government. On the first side, if we look at Chinese doctors, nurses, providers of care, for example, I think you've seen pretty incredible work being done that did set standards. A lot of the most important information that we got did not come, in fact, almost at all through official channels. There was very little, and we'll talk about that as one of the biggest failings by China and its leadership, because it is one that is going to continue over and over again, because it has to do with the nature of a Leninist dictatorship. It does not do transparency, okay? But if we look for a minute first at what Chinese citizens did, you had Chinese citizen journalists who were really among the first people to raise the alarm anywhere in the world about how dangerous this new virus would turn out to be. Many of those people have gone missing. Some journalists, including foreign journalists, were kicked out of the country for trying to do good work, going down to investigate what was going on in Wuhan. If you look at what some of the doctors were doing, is they scrambled to deal with something that the government had literally muzzled them, was not permitting the Chinese government to talk about this fast-moving, mysterious outbreak in Wuhan in late 2019. They shared information with one another using 小道消息, right? I mean, just talking to each other through social media, calling each other. Doctors, of course, like Li Wenliang, but he was not the only one to raise the alarm early, performed heroic service. A lot of the early techniques for caring for COVID patients were innovated by Chinese doctors and nurses, including oxygen therapy, how to optimize oxygen therapy for the most serious cases, turning patients over onto their stomachs, which actually allowed more oxygen to enter their bloodstreams. All of these things were innovated by Chinese doctors and caregivers. None of those lessons learned were shared by the government, and in many cases, the government explicitly prevented people from sharing that information. And the most important a couple of things of all, perhaps, were the brave scientists who made public the genetic sequence of the virus in Shanghai. If that had not happened, the world would not have been able to begin work on vaccines or even on diagnostic tests. So those were brave decisions in many cases in defiance of the Chinese government. We can talk a little bit over the course of this morning about the Chinese government's response. It was even worse than their response in 2002 and 2003 to the last mysterious coronavirus outbreak, which was, of course, SARS. The initial weeks involved a major top-down cover-up of the spread of that virus, denial of the fact that there was a problem, efforts to try to hope that it would just go away so that the Chinese government would not be blamed for it. And it was only after brave people within the Chinese system, again, doctors, spoke up and said, we have actually a major outbreak on our hands. The government is lying. Back then, you had someone at the head of the WHO who was at least willing to use her bullhorn to call out the Chinese government and say, we know there's more to this than what you're telling us. You need to open up and let us in. So the response was even far worse in 2019, 2020, unfortunately.
First, congratulations, Shirley, on CAPRI. I think this is such an excellent forum. We look forward to your research. For me, the China experience, especially now that we have dismantled the zero COVID restrictions, there's a lot of curiosity about what is going to happen next. And did China prepare enough in these past 3 years? And I think we can all agree that the answer to that question is no, of course. They had 3 years to prepare ICU beds, vaccines, antivirals, which they've only started importing and getting in larger numbers for the current outbreak, which is by far not enough to what they really need, given how infectious Omicron is. They haven't trained enough healthcare workers. And I think really what's about to happen with the Chinese New Year is this large amplification event that all of the folks who are in big cities and are being infected are going to go home to their rural areas and infect their parents and their grandparents. And these are the most vulnerable, least vaccinated, and of course has the poorest healthcare systems in these rural areas. So, there's the China COVID story is still being played out, and unfortunately, this is a dark period for them. There was little preparation for this period, unfortunately.
Thanks, Matt. In a Brookings volume published last month, CAPRI contributed to a chapter highlighting how democratic institutions and values, culture, and trust in government influence the outcomes of pandemic policy in Asia. Given what you just talked about on China, I think it's really important to know conceptually what we learned from this pandemic. From your experience in advising governments throughout the pandemic, to what extent can you explain those outcomes based on individual leaders as drivers, political institutions, culture, and other factors? What lessons can we learn from the US, from Asia Pacific, or from other countries that you're familiar with? Maybe we'll start with Matt.
Shirley, I think, something that I didn't understand until I was in government. I'm a former journalist, and this was something I didn't really appreciate while I was working as a reporter, but got to see up close when responding to this crisis, really. And that is that there is a tendency in all societies, including free democracies like Taiwan and the United States, to assume that politics is a bad thing, political decision-making is a distraction or an obstacle to actually just getting out of the way and letting experts do their work. Let the bureaucracy, the scientists, the public health experts make the decisions and lead the response to a crisis like this one. And that is, in fact, the wrong model. And the truth is that the advantage that democracies have is that there is accountability with politically elected leaders, and the public doesn't expect those leaders to be experts, and they do expect those political leaders to be informed by experts, but they don't expect the experts to make the decisions. They expect elected representatives to have good judgment, to be informed, and then to make decisions. I think that there's been a tendency to overemphasize the idea that if politicians would just get out of the way, it'll all work out. That is a delusion. Politics and the political process are what give legitimacy to government policymaking and even to its response to something like a pandemic. I'll mention a couple of examples of places where expert advice was wrong, turned out to be wrong, and where political judgments were made that helped compensate for early mistakes by the experts. One was the idea that you should never close the borders. That was something that was a virtually unanimous view as we were getting early feedback over the course of January. You never close a border because it'll only make an outbreak spread in other directions. It won't work. It's true that you can never really stop, as China has now learned the hard way, you can never stop a pandemic. But by closing borders early, when you don't have information, when you're not well prepared, you can slow down and delay the spread in ways that allow you to get your act together, to start trying to get tests together, to start working on a vaccine, to begin warning people, procuring face masks and the like. And so that was one lesson where it was a political judgment made to close our borders to China in late January. I wish that we'd closed the borders to Europe as well. We eventually did, but that was 6 weeks later, and by then it was too late. But we were able to buy some time. A second would be that expert opinion was that there's no real likelihood that this new pandemic, this new virus, could spread from asymptomatic people. And in fact, the Chinese government was telling the World Health Organization that this does not spread asymptomatically. We were getting separate information through unofficial channels from brave Chinese doctors who were telling us that the most important feature of this new mysterious virus is that it spreads asymptomatically. And therefore, your whole playbook that you're planning to use, which is a response to influenza, will not work. Because our influenza playbook is not to test people, it's to diagnose them based on a syndrome, fever, cough, these types of things. If half the people, as it turned out to be, don't express those symptoms, our entire playbook for dealing with the pandemic that all of our public health experts were beginning to execute will not work. And so it was actually political officials who were establishing those links behind the scenes with brave Chinese, ethical doctors and others to give us that key bit of information. Another was that masks won't help the general public. That was the view of a consensus of our public health expert leadership, was that we should not recommend to the American public that they wear masks. It won't work. That was a grave misstep that created enormous confusion later when that viewpoint was rescinded. And all we had to do was again, people who were not experts but who were just using their judgment to talk to people in Taiwan, talk to people in China, in Singapore, Hong Kong, South Korea, found that the disease was spreading much more slowly precisely because people were wearing masks. There was also a lot of public health expert skepticism about the approach we took to developing a vaccine, which turned out to be the one thing we really did well. The advice was it will take 18 to 24 months to make a vaccine because that's what it always takes. We will use an old-fashioned technology because we know how it works. Attenuated viruses is sort of the backbone for a vaccine. And there was a lot of expert skepticism of this newfangled technology that was being talked about called mRNA. Well, there was a political decision to work with a handful of experts who had a dissenting view in our public health apparatus. The dissenting view was, let's back every vaccine, fund all of them, start producing them now, but then go through the normal process of clinical trials to see whether they're safe and effective. If they're not safe and effective, we'll throw them away. But we want to have them made now rather than doing it sequentially in order to save time. Lo and behold, in less than a year, we produced vaccines with US taxpayer money backing them that turned out to be the most effective vaccines of all, and those were the mRNA vaccines. So again, there's a tendency by the press to say, don't politicize it. Actually, politicizing responses is the nature of democratic response to crises like these. To put it another way, if you were to have a pure technocratic approach where you only defer to experts to decide what's good, what's not, That is, in fact, the definition of an autocratic system. That's the way that autocracies have approached their response to this pandemic.
So thanks, Matt. This is really exciting. I always thought to myself, well, let's ask a few questions and pretend we're in the dining room and it's dinner time and the expert is talking to the policymaker. So with all that has been said about don't listen to the experts, Ying, what do you say to your husband?
Wait.
I do.
Listen but don't defer. You want a data-informed approach, but the decisions are going to be made by the accountable elected officials. But Ing will now scold me.
So I slightly disagree. I mostly agree. I do think that the decisions that are made do need to be made by politicians who need to be well informed and to listen to politicians. He gave you some great examples of where the scientists got it wrong. But to be clear, and I think that this was the problem along the way, was that the communication to the public wasn't that the science is going to change. We are going to make decisions as the science change. We had a brand new virus on our hand that was spreading asymptomatic. We didn't know anything about it. And there was too much hubris on the side of scientists who believed that a flu model and what we knew about flu would easily fit this new virus. And it didn't, right? And so we had to show a little more humility in what we didn't know. But I would argue at the same time, so some of our politicians, Matt was a lone star in the White House who understood how dangerous this virus was. Not everyone was like that. Not everyone believed that this virus was dangerous, right? Who wanted it to play out, no intervention, am I right? But luckily, you know, in our democratic society, they discussed it. They made decisions collectively in arguing their different viewpoints. And, you know, at the end of the day, the president made decisions based on information he got from both his office and from the scientists. So, and we can see the differences in the responses, of course, of the different administrations, which, you know, we'll address more. But I would say that the scientists also did, most of the scientists did what they thought they knew at the time, and that it changed over time, and we have to change our advice to the public based on what we know. Now, how we do that, of course, is a different question altogether of how we communicate, but it was an evolving virus. And think of all the things we know about the virus now that we didn't know at the beginning. We were all terrified, right? We were spraying down our groceries with alcohol and wiping everything. We wouldn't let anyone come to the door. So, I mean, we know a lot more about the virus now than we did, of course, at the beginning.
I'd only correct that I was far from a lone ranger in the view that this was a serious crisis that we were about to face. Many people, particularly on the national security side, were most attuned to how bad this could be precisely because we knew best the nature of the Chinese communist regime and what their pattern of behavior is. So we were the first ones to be skeptical of the information that the Chinese government was passing to the World Health Organization. A lot of our public health scientists, because they were hearing from other experts at the WHO, assumed that that was all legitimate, well-intended, accurate and transparent information. We knew that that was almost certainly unlikely to be the case, so we turned out to be right on that. But the people in the administration who did not want us to react overreact. In fairness, I think they were acting in good faith in many cases as well. A lot of our economic officials were afraid of the economic impact of things like border closures and all of these things. You want those concerns to be taken into account before you take a major step like deciding to shut off all air and sea traffic, into our ports.
Well, I think that what you described is quite important for us here in Taiwan. As you know, this is a place with many voices, and looking at our attendance today in person, we have some real experts, leaders in the public sector, private sector, academia, all here. And we totally agree with you that a robust discussion, transparency, accountability are key to basically excellence in public policy, in a crisis especially. But of course, sometimes the crisis takes over and there's very little time to discuss, or somebody has to make a decision. So since we're here, even though CAPRI basically does cover all of Asia Pacific, I like to ask a Taiwan specific question, because unlike your past trips, Matt, this was a 3-week stay. You have talked to a lot of people. You have looked all around the island. I think you went to Kaohsiung. So you have an appreciation for the kind of chaos democracies can be. And Matt's been reading local newspapers at our urging, and I think he's amused by all the things that he's seen. So in early 2020, many of the accounts from the New Yorker article to the books that have covered both of you talked about how you got a signal from Taiwan as to the nature of this pandemic. And what I like to ask is, what do you think of the COVID-19 response here in Taiwan today, 3 years into it? And furthermore, can Taiwan offer its knowledge and experience to the international community? And how can we also get help from the international community? Maybe we start with Ying first.
Great, thank you. So I think Taiwan, really set an example at the very beginning of the pandemic by closing its borders, by using, and I would say this is really the key, using its electronic databases while protecting security and privacy of its citizens, but having individual, numbers, unique ID numbers, linked to health systems, linked to emergency centers that track the pandemic, to use it for contact tracing and testing. I mean, really key to the first round, the first year of success here with the low deaths, the low transmission, and the world really needs to learn from that. The US, in all of our money spent on pandemic preparedness and all of the money we spend on improving health systems abroad through HIV, malaria, TB, we cannot implement this unique ID number, this case-based type of surveillance. It is nearly impossible, especially at home, where the electronic health systems differ by hospital systems, by state, and they didn't communicate. And so Taiwan is an example for every nation on how to manage surveillance and response early on to really mitigate and prevent infections. And I think that that's really the essence of how well it did, and that the contact tracing was effective, and really the citizens trusted the government and listened to the pleas to wear masks, right? And everyone wears masks, and you can see it now. Everyone still wears masks outside. The rest of the world, at least where we live, no one wears a mask indoor or outdoor. So to see masks and compliance around masks outdoors is actually quite staggering. But these were very key. I think we can all agree that the pandemic has lasted far longer than any of us thought, and that we're going into our 4th year with such high infection numbers, China and elsewhere, frankly, because Omicron has really shown us how good it is at infecting people. So there are different stages, and every country looks good at different stages, right? We're all early on, I would say Taiwan had a very good response by preventing transmission. And then we moved into the vaccine type of stage, right? We bought ourselves that time, the US government funding Operation Warp Speed, and having really effective vaccines. And then that shifted the pandemic into a different phase. And this is where different countries had different responses based on their availability to make or get the mRNA or even the Johnson & Johnson or the AstraZeneca vaccines. And I would say here as a general comment, nationalism and vaccine development don't really go well. It's not in the best interest of your population, right? I think we should just allow the science, whoever made it, really to dictate what we use, as opposed to saying, we're not going to use that, even though it might be great, and say, we're going to develop at home, we're going to distribute at home, we can make one just as well to prove a point. That's at the detriment of your citizens and your public health.
So Matt, could you answer the same question, but I'm going to add a little bit more to your question, which is, speaking of the international community and what Ying just said about vaccine equity, vaccine distribution, which our group did quite a lot of research last year. we have all been turning to the WHO for guidance and policy during the pandemic. As you both know very well, Taiwan is not a member of the WHO. So what does the international community mean to all of us living on this island? How can we better coordinate to predict, prevent, and respond to new health threats given its exclusion from the international community?
So I think there's a misunderstanding, a misapprehension about what the WHO's mission is, what are its capabilities, and in order for us to realize that the WHO is, in essence, a normative body. It creates standards. It's done some very important work for long-standing chronic and infectious diseases like malaria. It has a lot of talent that goes there to work. What it is not is a fast-moving organization to deal with a fast-moving pandemic. It does not have the ability to enforce the rules that it so painstakingly writes. They rewrote all of the rules for all the member states after the SARS epidemic back in 2002, 2003, and China promptly in 2019 ignored every single commitment that it made to the WHO, and the WHO couldn't do anything about it. It doesn't have the ability to enforce. It's a membership organization. It's a club, okay? So what we need, one of the lessons I think that came out of this pandemic is the need for a new international body, not to replace the WHO. WHO can keep doing what it does, but we need an international group focused first on a backbone of core democratic societies that can respond quickly and share information quickly and help in the international response to new outbreaks. And so this organization was something that we were looking at trying to get done in the closing months of the Trump administration. I'm still hopeful that the Biden administration picks it up and runs with it and improves on the idea. But the idea is, I call it CPR. It's just a coalition for pandemic response. And the idea is that you take the G7 countries, those industrialized democracies, the United States and Japan, the UK, France, Germany, Canada, and Italy, and then also add India, Australia, South Korea, Brazil, and Taiwan. It's a dozen, I guess that's a dozen countries who have accountable governments, freedom of speech, rule of law, and in the case of some of those countries, like Taiwan, as you just heard, have a track record of doing really well in their initial responses to fast-breaking pandemics. Taiwan shared information early. In fact, they warned the WHO, even though the WHO comically doesn't even recognize the existence of Taiwan. Everyone has seen that interview by the WHO official, and a Taiwan reporter is asking, and he hangs up the phone. He didn't want to acknowledge that Taiwan even exists. So Taiwan was very good at sharing information early. Taiwan was great at its PPE. I'm still grateful to this day. Chen Jianren, I called in the pandemic to let him know that the United States did not even have the means to produce masks. And Taiwan, once Taiwan had achieved surplus, had been able to provide for all of its own people, Taiwan began providing masks to the United States and to other countries as well, and allowed us to start replenishing our national stockpile, which ran out within a week of New York City getting sick. So it would share information. It would create really the equivalent of a weather map or a radar system, to use an old World War II analogy, or a satellite system, to use a Cold War analogy, except this would be biological intelligence sharing, testing for new dangerous pathogens or potentially dangerous pathogens, sharing that information, coordinating the response with vaccines, PPE, therapeutics, and also drawing up a response collectively to address those countries that are not living up to the most basic humanist principles to share information and take steps to protect other nations. So that's the idea. We called it ARROW in the Trump administration. It didn't get off the ground. America's response to outbreaks, but really it's the international dimension that makes it. So I hope the Biden administration comes up with another name for it and launches it.
Okay, that's great. Now we come to the juicy part of the interview. So early in the pandemic, of course, we know as the chair of the International Advisory Council of CAPRI, Malcolm Turnbull, loves to say, the pandemic is an examination, and everyone was equal. Everyone took the test, and the U.S. failed pretty miserably in its first response. Through your experience directly in advising American decision makers during the pandemic, can the two of us tell us how did the United States, ranking #1 in the Global Health Security Index, with the preparedness and readiness that it and the leadership it had, how did it not translate into an agile response? And could you tell us from firsthand experience what went wrong?
I think we're going to need a few more hours for that. So the U.S., before COVID, had spent billions of dollars in pandemic response. We were preparing for pandemic flu. We were preparing for Ebola, right? We had a Zika outbreak. So it was on the minds of many public health officials and got funded for getting ready. And what did that mean? It means stocking the National Strategic Stockpile. Unfortunately, it should have meant preparing our health data systems. And what the U.S. is really good at is doing pandemic response on other people's shores, right? During the West Africa Ebola outbreak, we were excellent. Got our people on the ground, CDC was on the ground, coordinated with other countries, coordinated with our military to really get in there and really do the work of, cracking down and preventing spread. And of course, there was a few instances of people who left West Africa with it, but they were healthcare workers, doctors and such that were there for the response. So we're really good at that. We're really good at dealing with HIV in Africa and other parts of the world. We, lead in that. We've saved millions of lives on the HIV front. Unfortunately, for a fast-moving virus, respiratory virus, all of a sudden, everything we knew didn't work. Our National Strategic Stockpile had expired PPE. We don't do well when it's actually preparing, right? We say we want to prepare, but we don't really do the work. And so our stockpile wasn't really there for us, or didn't last long enough for this type of response. Our data systems were in shambles. People were faxing. You guys remember a fax machine? There are young people here, probably don't know what they are. But you stick the paper in, it comes out on the other side. It's on email, no computer involved. People, they still faxed their daily case counts to CDC or to the state level, who would then send them in to CDC. But no joke, half the system was based on old reporting that was all manual, and then someone on the CDC side has to tally these numbers up, right? So we didn't have the actual systems nationwide in place to deal with the pandemic. Maybe you can expand more on the White House view.
Look, I think that I remember reading, it was maybe about a year ago, the New York Times had a front page article talking about the failures of the Biden administration in responding, and what it found was the Biden administration was struggling with a lot of the same problems that the Trump administration had struggled with. And so I think a lot of those are institutional. It's not only political. You must have good political leadership. I think we fell short on messaging because there was a lot of confusion about how serious to take it, how not serious at federal and state level. Remember, the United States is 50 states, and the public health response is in fact distributed to the leaders and elected governors of those 50 states. So you had this patchwork of different responses and a very poor sort of lessons learned process to look at what was working in some places, to ingest those ideas and then make those lessons available to other states that weren't doing as well. But the institutional failures, I think, are the ones that most desperately need remedying, because you can always hold officials accountable. Presidents get unelected just as easily as they get elected. The same is true of governors and mayors. But what you still have are a lot of lessons that should have been learned that have not yet been applied because they've not been institutionalized across the public health bureaucracies of the 50 states and the federal government in the United States. The Centers for Disease Control, I know a lot of Ng's old colleagues there. They're fantastic, talented people at the CDC. But let's face it, the CDC has a culture that was not responsive to a fast-moving, dangerous pandemic. We learned as the spring, the winter turned into spring of 2020, that the CDC was not even collecting a lot of the data that Ng was just talking about. That some people were faxing in. The CDC did not view it as their responsibility. They viewed it as a state responsibility to actually track the pandemic. The CDC is so good at doing modeling that they actually came to view modeling as a substitute for a preferable substitute for hard data. So it was only when Deborah Birx, the White House coordinator, began, in essence, threatening all of the hospital systems around the country to say, if you don't provide data on the caseloads, we will withhold federal assistance for some of the therapeutics. That worked like a charm. We went from only 40% of hospitals reporting caseloads to almost 100% in a matter of weeks. The CDC did not view that as their job. So we had to do it at the White House, which is a little bit crazy. You have to know the numerator and the denominator. You have to know how many people are testing positive, but you also have to know how many people are testing negative in order to make an accurate assessment of the velocity of spread. The CDC did not believe it needed to have collect information on negative tests, only positive ones. So none of these things have really been learned. Our data management, we have a lot to learn and to try to implement. And we can learn from Taiwan on that as well, a free society that respects privacy rights. You have to do it in a way that continues to respect privacy rights, but you've got to have a better data management system in order to have eyes and ears on what on earth the virus is doing inside your borders.
And can I just add in there, I'm a former CDC employee. I worked there for many years, and it's an agency I absolutely love. I believe in their mission. I work with them daily still at Columbia. But they certainly, and I think everyone at CDC, including the long-term staffers, will agree with you that their pandemic response was not up to speed and did not serve the American public in ways that it should have. And in one of the, in addition to what Matt said, I think the political will and the communication was really not entirely there, right? Like you talked about the 50 states, they had different responses because of, unfortunately, the politics around it and the political will to combat it. And that's part of our, unfortunately, failing, right, is that we built mistrust in the way we communicated with the public, in the way our elected officials, in the way our public health officials communicated to the public, which led a lot of skepticism around different things at different points, like should you use masks, should you not use masks, when should you use masks? And I think the communications and how we move forward is really key. And we actually got to see it play out again during the monkeypox outbreak. And unfortunately there, we also saw, unfortunately, that we were still not ready for a pandemic response in the US. We had the highest caseloads of monkeypox in the US after the initial outbreaks in Europe, but our stockpiles weren't ready for that. We paid for 1 million doses of monkeypox vaccine, the effective one, and didn't have it because we only paid for it. We didn't expect actual delivery of it, apparently, from the vaccine makers. And so the vaccine makers just kind of, unfortunately it was one company and they made small numbers of it and would give it out. And eventually we had to split the vaccine up under no clinical trials and divide into 5 doses basically to give to at-risk population. But it showed us again that we were not ready for a pandemic's response. So it's going to take a lot of willpower for us to get ready for the next one. And of course we all know there will be a next one.
Yes, let's come to a very important question. What about the next one? By the way, I just want to mention what both of you talked about. It's really important to note that Taiwan struggles too, to use innovation to fight COVID-19, use technology, and at the same time protect personal privacy. So along those lines, we worked with Brookings and wrote 5 policy memos on this exact topic. And Dr. Jean Tsai at Taipei Medical University Hospital contributed to a chapter on how Taiwan actually societally, a government, weigh this issue. And I think that's what's very precious about society, that is openly discussing trade-offs. And here comes, of course, the topic that we had wanted to discuss today, which is the next pandemic. So the origin. What exactly caused this virus? We're 3 years into the pandemic. And it's important to, why is it, do you think, important to understand the origin of severe acute respiratory syndrome coronavirus 2, which of course, it's the virus that caused the disease COVID-19. What is your understanding of where it came from, the controversy? What are some of the challenges in identifying its origin? And will China provide any answers so we can understand COVID-19's origins in order to prevent the next pandemic?
Want me to start? Well, look, the last question's an easy one. Is China going to help? No, not while it remains a communist regime. I think there are a lot of ethical scientists in China that know more about the origins that hopefully eventually what they know will be made public and available. The Chinese government has taken extraordinary steps to ensure that no one can credibly investigate the origins. I think very early on there were unfortunate decisions made by some experts who had very little data to jump to the conclusion that it must have come out of nature. And while it's still possible that that will be what we eventually learn, that this was a naturally occurring virus, it's now widely accepted, supported by U.S. intelligence reporting, inquiries by members of Congress, enterprising journalists, and others, enterprising scientists out there, that it is very possible that this came from an accidental leak from the Wuhan Institute of Virology. It's going to be very important. Ing can talk a little bit to why it's important to learn. But look, you have the Wuhan Institute of Virology has all along presented itself as a civilian organization. But the U.S. government determined with very high confidence that in fact it was conducting secret research on behalf of the Chinese military. It was doing classified research using lab animals going back to at least 2017. The leadership of that lab and many of its senior officials have denied that. That intelligence information was made public by the State Department in early January. So there's a great deal of information that I still think we need to delve into. I think the U.S. government, given that the National Institutes of Health were funding some of the activities around the Wuhan Institute of Virology with the goal of trying to prevent pandemics, needs to do more to make public all of the applications, the grants, the communications between senior NIH officials with other scientists. They've dripped out little bits of it, heavily redacted in response to Freedom of Information Act requests. They really need to just come clean and make all of that information public so that we can conduct even better informed inquiries about the origins of this virus.
So the question is, why do we need to understand this at this point? You know, we've been living with it, we're responding to it. Of course, it plays into the next pandemic. We don't know where it came from, but we know it's really two possibilities. Did it come from a zoonotic transmission somewhere between an animal and a human, right? And this happens, by the way, daily. It happens all the time because we are at this border with animals all the time. We interact with them. There are bushmeat hunters who hunt monkeys, right, who cut themselves. This is an occurring activity because we live with animals all the time. And they have viruses, and we have viruses, right? So we cross interact all the time in that front. Usually viruses don't, we're dead-end hosts for them. If we get infected by animal viruses, it usually dies with us because it's not well adapted. So what do we know about the origins of this particular virus? Well, it could have been that zoonotic, or it could have happened as a lab leak, and with no assigning of intention, right? We don't know, most likely an accident. This happens all the time in laboratories. Good laboratories and bad laboratories where you're tired or you're not paying attention, you're pipetting, you prick yourself with the tip of a needle, a pipette. It happens everywhere. Now, what are the consequences? Well, it depends on the pathogen, of course, that you're working with. If you're working with a low pathogenic BSL-2 type of pathogen that doesn't really infect humans, not a big deal. But of course, if you're working with a high risk, high pandemic potential virus, it obviously is a big deal. So we know it's one of two of those scenarios, really. And in the media, it's actually not very nuanced in terms of that lab leak. That lab leak and the natural, and people argue it's a natural virus, it probably did come from a bat, no question, and was collected, because we know that the Wuhan Institute of Virology, in fact, went out and collected bat viruses. And then it was researched upon, and other people use the word manipulated, whatever. It was being researched upon in that laboratory, so it had a natural origin. It was then manipulated, researched upon in the laboratory, and possibly it could have left through a staff member who pricked themselves or whatever. But the point is, so it's lab leak or zoonotic. So we should prepare for both, right? How do we prepare for this biosafety issue? Well, I think what we need, as more countries after this pandemic realize, well, we all need a BSL-4 facility to do research. So more countries are building these high containment laboratories, but there's no global standard. If you read about the early days of China's P4, BSL-4 facilities, you'll know that, in fact, they had no expertise to even set it up, how to run it, how to do disinfecting. So we need a global accreditation body that inspects these labs, that holds them to certain standards, as SOPs on disinfecting. How do you enter a lab? What do you gown with? How do you degown? Like, all of those things should be standardized across the globe, because the not doing it has such repercussions for humanity, right? And so we also need global standards for the type of research that, you've probably heard this gain of function research of high pandemic potential viruses. We've had a lot of discussion in the US about this even before COVID, because people working on flu were introducing mutations that made it very infectious to humans. And the government, under the Biden administration, over the Obama administration, halted this and brought about this discussion of what should we actually be researching? Is it beneficial to humanity, or is the risk outweighing the reward of this? And I think that there should be more discussion and more standards, guardrails around what kind of research should be done. And then on the zoonotic front, there's many ways. First, we probably shouldn't go into bat caves and collect all of these viruses that we know infect humans, even in their natural form. So, and other protections around, like, there are other virus hunters in the world who go out, and we learn important things from viruses, by the way. They have given us HIV, retroviruses gave us an enzyme that allows us to do PCR. I know you all know PCR because of the testing around COVID, but they're important sources of medical advances are in the viruses. So we kind of need this balance between benefit and risk around how much do we go out there and collect these viruses that are naturally occurring.
And this could be one of the first tasks of a new coalition for pandemic response, that a dozen countries, including Taiwan, that could draw up those guidelines and find incentives to enforce them. We know enough there's more or less a consensus that this could have come out of a laboratory that was doing risky research in Wuhan, or it could have come from nature. That it should be enough information for the world to act. The U.S. has to lead if we're going to get something done, and I think it should use a coalition of democratic allies to do this. But it is drawing up those gain of function guidelines. If we're doing high risk, low reward, or even high risk, high reward research, we've got to have a much better idea of whether it's worthwhile or whether it's worth the risks. And then all the things having to do with wild animal trade as well. Those are things that we can address.
Thank you. Well, we
But haven't.
but have not. We can go on about this for far longer, but I see that we're down to 30 minutes on our program, and I want to have two of our experts and the audience ask questions. So first, I'd like to introduce Professor Chang-Chuan Chan. If you can come up to the podium. Briefly, our founding director of CAPRI was my classmate at Harvard and the former dean of the College of Public Health at National Taiwan University, a renowned public health expert especially in Asia Pacific. He's known a leading researcher on environmental epidemiology and global health governance. I'd like Chang-Chuan, if you can give us some comments about what you heard today and about Taiwan, and ask them the question you wanted to ask.
Okay. Thank you, Shirley, and welcome Yen and Matt to Taiwan and bring your experience and wisdom to share with us. And first of all, I would like to share my personal experience of this ongoing pandemic. As you were struggling to convince the White House there's upcoming dangers from China about this new virus. And I was called upon by then Vice Premier Chen to verify information he got from social media about mysterious pneumonias in Wuhan. I spent a couple of hours and through all the channels I had and come to the conclusion that you just mentioned in your remark, experts and politicians, right? And Chima was my former student. So he trusts me, and I told him I cannot verify. But I believe we have to take it serious, and it should be a new disease. It should not be SARS. But we don't have anything available at that time. So we have the SARS protocol that US CDC helped us to draft after that. Then apply it, but it's definitely not be SARS because it can be recognized very easily by SARS testing kits. So we took this action very early at January and December 31st, 2019. That's how it all started. And as you know, it evolved. We apply all these public health measures, mainly non-pharmaceutical interventions, border control, masking, social distancing, delaying, gathering, all these kind of things are actually formulated in his office. And as all the island nations in Asian Pacific were doing very well, right, by doing these actions before WHO gave the warning to the world. So that's what I want to share with you. And we are luckily in a lot of island nations like Taiwan, Japan, Singapore, Australia, New Zealand. We are all spared of major outbreaks at the beginning of the pandemic, especially the first year. And the Delta attacked many other countries, right? Now the Omicron, the third year of the Omicrons that we observe. So I read a lot of reports and about you, and I follow. If we look at you before you are in White House, after you left White House, and I saw there's an increase of infections cases worldwide, and especially in U.S. That's winters, that's very bad, and in Taiwan too. So right now, U.S. has about 1.1 million deaths out of 6.7 deaths reported. If you count the excess deaths, it's even more, right? And Taiwan, unfortunately, we have more than 15,000 deaths due to mainly Omicron, COVID, right? So the beginning success, why the beginning success cannot carry on to the current situations? That's the question I want to ask you about Taiwan. The other questions I want to ask you, the change of government in US from Trump to Biden, and you see this pandemic continues, and Biden has all these tools available, vaccine, medicines, everything. And you talk about institutionalized measures that has been not implemented in US yet. But there's still something that I want to ask you. Why you cannot prevent more infection and disease in US, even the change of leadership? This is very important because, now after this pandemic, there were two models, China model and US model, right? The democratic models, how to deal with future pandemic. So this is two questions. One is about US, one is about China. And thanks again for giving us this wonderful talk. Thank you.
I'm going to tackle the first one. Thank you for those questions, and thank you for sharing your experience. Like I said, I think that because the pandemic has been going on so long, every country has had different phases, and in those phases have looked good, right? Like in the US at this point, we're like, well, we're doing okay because we got all of those surge out of the way, we're open, and we've moved on. But I would argue, like you, those over 1 million deaths seemed unnecessary. And what Taiwan and New Zealand and Japan did early on by closing borders and really using those non-medical interventions to prevent infection bought you so much time, right? If you hadn't done that, I would argue you'd had far more than 15,000 deaths at this point, right? To have in that first year 7 or 9 deaths is no one would have. Like that's a number that seems extraordinary still. And so in that first phase, I think your reaction and the way you handled the pandemic was in fact what was best for your population. Of course, your population trusted you and followed along. I would say that's a little bit different in the US, where free will dominates our response, right? Like we have our politicians who impress upon their citizens, their opinions, and then the American people, at the end of the day, will do what they want to do. And that's part of the democracy of it. And unfortunately, we pay the price for that by having a lot of deaths, and many of them unnecessary. But the vaccines really shifted the conversation. And I think what surprised us about the vaccine was, while they didn't prevent infection, they surely kept a lot of people alive. And our numbers would be far, far worse without, the vaccines, and even let's say the poorer performing ones still work extraordinarily well, right? If you compare them to the flu vaccine, which has a 40 to 50% effectiveness every year, I mean, even all of the old technology that we made into COVID vaccines worked far better than that. So that's the first part of the question.
Look, I have sympathy for officials, in the Biden administration and elsewhere, who are dealing with this. I mean, it was the most stressful period of my life. Those initial weeks and months dealing with this pandemic, and it is not easy. I think the main thing is recognizing that the lessons that have been learned, that have been accumulated, need to be applied. One lesson, at least knowing my own country and just the character, the American character, is that it does not want to be pushed around by its government and told what you must do. I think that we've actually done pretty well on vaccine uptake, and there's been too much focus on the small percentage that are hesitant to take vaccines, and so there have been efforts to try to shame or coerce people into getting those vaccines. I think that was a mistake. I think that people are more likely to overcome hesitancy if they don't think they're being forced to do something, which is a very personal kind of decision. You're going to have a new vaccine jabbed into your and your kid's arms. I'm vaccinated. I've been boosted. My kids have as well, and I'm very grateful that we have access to that kind of care. But mandating people to do something in the United States situation is not a winning formula in my view.
And can I add one more thing to answer that question? The thing that we did not predict, myself included, was actually how the virus would mutate so aggressively. Early on, we said how this virus is actually very stable. This family of viruses is actually very stable. It's not like an influenza, but the virus has surprised us and continues to surprise us with its accumulation of mutations and the speed at which it does it, frankly. But the speed is actually related to, of course, the number of infections globally. Every time someone gets infected, the virus has a chance to mutate. And within that person, millions of times, right? You're making millions and millions of virus particles. So it has an extraordinary opportunity to mutate because we haven't really effectively controlled infection numbers. And I think with the China outbreak, we can be sure that there will be new variants. What their impact is, it's too hard to say at this point. It's like, will we see another Omicron diversion? So from Delta to Omicron was an extraordinary jump for the evolution of the virus. It gained so many mutations that it shocked everyone who ever worked in viruses, truly. But we've been, let's say, lucky this past year. Omicron has been so dominant, it hasn't spurned a new variant, a new branch on the chain. That's what's in store for 2023 is, is the extraordinary numbers coming out of China going to give us a new variant that is either more infectious or more deadly? And by the way, people have this notion that new variants or viruses mutate to become less deadly and more infectious. And I would argue that that's not necessarily true. If you recall, Delta was more infectious and more deadly, right? So we don't actually know what direction it's headed. So far, it has become more infectious under the pressure that we have given it through our vaccines and our infections, but it hasn't been more deadly. But I wouldn't bet on the next version necessarily being less deadly either.
Thank you. Well, speaking of expert, we have one more of our board member, Harry Harding, who will come to the podium. Harry, my colleague at the Miller Center, helped me with Chang-Chuan, as well as Professor Mimi Riley at the UVA Law School, as well as Alicia Garcia Herrero, also our board member, in putting together all the questions that we had asked today. They were not my personal questions, long arguments about which ones to ask. And Harry is the last member of that research committee who is going to ask, probably, hopefully, a question about U.S.-China relations, which he's an expert on. He's also the university professor emeritus from the Public Policy School, the Batten School of Leadership of Public Policy, and currently a Yushan Scholar at National Zhengzhou University. Thank you, Harry.
Thank you, Shirley, and especially thanks to Matt and to Ying for really a very informative and very exciting in some ways set of presentations and answers to questions. Like my friend and colleague Chang-Chuan, I'm going to ask two questions, and you can figure out yourselves how you want to answer them in what order. One will be on what I think many people would agree has been the biggest success in the management of the COVID pandemic so far, and the other, either you could describe it as the biggest failure or at least the most controversial aspect of it. The biggest success, as has already been said, is the development not just of a vaccine, but a whole new kind of vaccine, the mRNA, which has surprised people at how quickly it was produced and how effective it has been. Not perfect, as Ying has said, but in terms of controlling spread and reducing the impact, it's been a real success story and done, as the Trump administration liked to say, at warp speed, very, very quickly. But the development, the invention, if you will, of a new vaccine is only the first step. Then you have to have it manufactured, and most importantly, you have to have it delivered, not just across national boundaries, but within countries. And of course, you have to have, especially in freer societies, a willingness to take it. And I'm wondering what lessons you could learn about those subsequent stages beyond invention. How successful have we been, and perhaps especially in the international dimension of distributing the vaccine to poorer nations around the world, including here in the Asia-Pacific region. Then my second question has to do with what I said many people say is the biggest failure, but at least we can be a little kinder and say the most controversial. And that is the combination of what I would call lockdown and lockout. In other words, the control of movement of people, whether symptomatic or not, whether infectious or not. As you say, we don't really know often whether they are infectious. By lockout, I mean the restrictions on movement into places, whether it's across national borders, whether it's going to the theater, whether it's going to a restaurant, whether it's going to the gym. Different countries, different municipalities have had different restrictions on movement, and those have been obviously very controversial. Many people have resisted that restriction on their freedom of movement, either for business or for leisure. What do we know about how effective that was? And even more, of course, then there's the question of lockdown, as in China. The question of the restrictions on movement out of their homes, going anywhere, became impossible. What are the costs and benefits of those measures of lockdown and lockout? What can we learn from our experience up to now as to how cost-effective those are? Thanks.
Thanks, Harry. I'm going to tackle the first one because the second
Great.
one seems harder.
And if we can make it brief, we now have a flood of questions from the
Okay,
audience. If we could be brief on both.
So on the vaccine production, manufacturing, distribution front, I think it was very clear to everybody the inequity of it, right? And there were countries that made it, had it in high numbers, and then of course there were countries that did not have any or waited for donations and took them from, frankly, anyone who would donate to them regardless of the vaccine effectiveness. And I think that there are many lessons to be learned in this. We need to diversify where we manufacture vaccines, but and support these manufacturing facilities. But we need to support them even when they're not making vaccines, right? Which is what we learned from a South African plant that was invested in. They came up to speed and they didn't have a single order. Right, so in diversifying, we need to take that approach of making it whole in the sense of like there's no loss for them so that it's sustained and is ready to produce vaccines as needed during pandemics. I think having a regional approach is also a good idea in terms of having like Asia support Asia manufacturing and distribution, especially in Asia. We have high-income countries like Taiwan versus our lower-income countries, which waited for donations, and of course the Africa situation looks very similar in that. So there are so many lessons to be learned on the vaccine front, and we all know the vaccine was the biggest scientific discovery of 2020. Frankly, it's really about how do we equalize it in its distribution. And by the way, that lack of equality is what keeps driving us, right? It keeps driving these infections number. If we could have blanketed the entire globe at the same time in an ideal world, we probably would not be seeing the numbers that we see in terms of deaths. Africa was very lucky, by the way. We were predicted very early that it would be disastrous for Africa. Their demographics with younger populations worked out in their favor. And unfortunately, that is because of other pandemics that have affected their older people. So different responses in different populations, but much to learn on the vaccine front.
Well, I won't add much. There are other vaccines as well that are being worked on that use technologies separate even from the mRNA technology that's had success. There's a nanoparticle vaccine that's under development that I don't know much about. Defer to you on that.
How about we end on that?
Yes.
Okay.
Why don't we
Oh,
come
yeah,
back to scientific
That,
discovery?
yeah.
But one of the next innovations might be is what I was talking about, this idea of a of a global weather map where you can detect potentially dangerous pathogens early, not just new variants of COVID, but other things, whether they come out of nature or out of labs. Unfortunately, labs are doing really high risk, dangerous, and often also unethical work, or at least the leadership and motives of some of the lab work is not ethical in some cases. Lab leaks happen, we know that. There were several cases where the original SARS virus was accidentally leaked out of labs, sometimes with fatal consequences. By China's own admission, a lot of the coronavirus research they were doing was in BSL-2, level 2 labs, which isn't much protection at all.
Thanks, Matt. So we have only 10 minutes for 3 good questions. So I'm going to pose the first one to Matt and second one to Ying at the same time, so you can think about your response, and the third one that will go back to Matt. So Samson Ellis from Bloomberg asked, you call for a new global health organization, which would be unlikely to get authoritarian government to join. Would this create a divide in global decision-making that excludes much of the developing world? To Ying, this is from Kelly Yang, a current student at Wesleyan University. Both of these people are in the room today. You talk about the importance of democratic political intervention in responding to COVID. How should a government decide which factors are important to prioritize in decision-making on a public health issue? So, Matt.
Yeah, so for the Coalition for Pandemic Response, CPR, the idea is that the backbone of this organization should be open societies, ones that are trustworthy, that have accountable government, to share information, coordinate responses. They're going to be the ones, just as with this last pandemic, are the ones that actually get vaccines done, innovate and distribute therapeutics and the like. And so it's not that you would deny cooperation to authoritarian governments, whether they want to be part of such an organization or not. They're going to come knocking on the door of CPR because CPR is going to be the one that has answers, that has data, that has information about where the pandemic is, that has access to resources and a secure, non-coercive, by the way, set of supply chains for drugs and for syringes and the like. Remember what Beijing did early on was it decided to weaponize its monopoly on a lot of the materials that countries needed and to make political demands of countries in return for getting access to Chinese equipment or drugs and the like. We're calling for the opposite of that, something that does not permit that to take place. So governments everywhere in the world, irrespective of whether they're democratic or not, are going to want the help of a trusted, free, an open society-rooted institution that can actually respond effectively in ways that the WHO and authoritarian countries were not able to.
Ying, how should a government prioritize?
Right. So I think the priority comes in the form of where you get your biggest reward again, right? And really streamlining your communication. And when I talk about government response, we have to remember that we have a federal, well in the US, federal, a state, and a local level. And they weren't always coordinated, right? Because we know that there are different politics that play out in cities versus rural areas. So about prioritizing what gives the public the best advice and information stated in the most clear manner that is going to protect them. I mean, that's ultimately what we're trying to do. We're trying to protect people from getting sick and dying and, weighing out things that are easy to implement. I think the social distancing conversation that we had early on worked well in the US. Again, we don't like to listen to people, but I would say everywhere, social distancing actually was very effective and it continued for quite a long time, no matter where you were, because your neighbor here could infect you and make you sick. I mean, that was very easy to understand. And what I've learned in public health is you can't do anything without community leaders, your local community leaders, and part of the vaccine hesitancy, part of just messaging coming through local leaders either through like your local government, your public health officials, your churches, people you trust, your doctors, your own doctors. That's how you get people to really understand and hear what the threat is and how to prevent from getting sick, right? It wasn't, at the end of the day, a lot of those people heard, Americans heard the different news, the news conferences of all the officials standing up there, but they were still confused. They went to their doctors, and it depended on what their doctors told them or what their church leaders told them. And I think I'm focusing on communication because actually at the end of it, communication really hampered us, both in the Trump and the Biden administration. I want to be very clear that both of them failed. The Biden administration relied too heavily. They wanted to bring the science back, which is great, but the communication coming out of the White House wasn't actually well vetted with the White House, and so stumbled multiple times on that front, especially around mask use. So I really want to emphasize the messaging.
Thank you, Ying, for actually a little advertisement for CAPRI's current research is focused on vaccine hesitancy, focusing on both the culture, history of all of those factors, culture, history, basically national, subnational, global governance. And we welcome both of you, your input into our research as we go forward. So the last question is from online, from Patrick Wilson, who works at MediaTek. Was it a good idea for the US government to force private companies to make respirators and other medical equipment?
I remember when that happened, the president invoked what's called the Defense Production Act, which is usually a wartime authority rooted in an old law that allows the U.S. government to make priorities for what will be produced and what won't. I haven't looked closely enough at the results, except my hazy recollection is that we made so many respirators through the use of the Defense Production Act that we were providing them to a lot of other countries around the world. Ultimately, with this virus, once you're on a respirator, obviously you're in a lot of trouble. I don't know what the rate of survival has been for those who ended up having to go on respirators. I'd have to go back and look. So I do think the Defense Production Act is, and the equivalent in other nations, is a tool that we still need to keep handy. It produced more than ventilators in our case. It also ended up producing some of the N95 masks that we weren't able to get from abroad as well. But yeah, it's not ideal circumstances to be forcing those sorts of decisions. But sometimes it is necessary.
Well, I want to end the program by asking Ying a very important question. What have we learned? What kind of scientific breakthrough have we seen? If this pandemic was worth it, if at all, hopefully something good came out of it. Can you give us some light at the end of the tunnel?
So every pandemic actually pushes the medical field forward, and that's the optimistic plus side of pandemics. It actually moves all medical fields forward. HIV did that for across the board, for cancer, all these other things. And COVID is really doing the same thing. The speed at which every scientist who was a cancer researcher, who did other things, became a COVID researcher was like this. Overnight, people understood the importance of focusing on it. Like I said, the mRNA vaccine was the biggest technology scientific breakthrough. But to be clear, it didn't just happen in 11 months, right? We had the platform, people were working on it before COVID. We used it for the Ebola outbreak. It didn't get approved because the Ebola epidemic was stopped, and so there wasn't enough people to do clinical trials. So it didn't just happen anywhere. But the mRNA technology will spurn an entire new age of vaccines, frankly, for cancer, for personalized cancer, for all sorts of new viruses and old viruses, flu, HIV, which have not, like I mentioned, the flu vaccine doesn't work very well. So it's allowing us to reevaluate and look at where we've been effective, how do we improve upon vaccines. And I think the biggest breakthrough, let's hope it's this year, is, and really have the greatest impact on this pandemic, is a COVID vaccine. And there's early work on it, shows great promise. And the idea is you would make a nanoparticle and put the spike protein from all of the known beta coronaviruses, from bats and other human ones that on there to have cross-reactivity so that we can then combat SARS-1, MERS, and SARS-CoV-2 and hopefully in a way that prevents us from making more variants as well. So, and having boosters every year. So keep an eye out for this coronavirus vaccine. I think that that is going to be the biggest game changer that there is for us combating this pandemic.
Thank you, Ying. Finally, something uplifting for everyone to start their day. Really appreciate your time. Ying and Matt didn't just show up today. We've spent hours doing the programming and really appreciate it. I want to say thank you so much for my founding board members. Irene, Stan, and David are all here. As a new organization, our support from the community internationally has been extremely important for us to find talent, to have new programs. And everyone in the audience, by virtue of being online, watching, wherever you are on a very late evening, thank you for staying up. And for everybody who's come to this ballroom today, I want to thank Howard Witt and my colleagues at the Miller Center for staying up this whole time to do the webinar, Eddie Liu and her crew for providing the technology for streaming, my founding staff members, Cecilia from Hong Kong, Siwei from China, and Caroline from the United States all joined me and started to live in Taipei for our small venture. And if you are interested, here comes the very important news. Matt will be giving a speech in Chinese tomorrow at National Zhengzhou University. All of you are welcome. It will be streamed if you don't want to go to Muzha. And there will be no translation, so Chinese speakers only. And he will be speaking on national security. So welcome to that. Thank you very much again. Keep an eye on our website for more updates, and have a great rest of the day. Goodbye.
It's not mine. It was very